Today, as the governor mentioned, he did direct me to sign the Safer at Home order, which I have done. As the governor said, this decision was not made lightly, but it has become necessary to stem the tide of COVID-19. It was made by listening to the advice of our public health experts, and it is abundantly clear that you are safer at home. I've heard some people question why we're doing this when there are only 457 cases and 5 deaths in a state as large as Wisconsin. Our state benefits from the experience of others who have come before us in this pandemic. Our experts are comparing our data to the Wuhan and Italy experiences to predict what is likely to happen here in Wisconsin. And if we continue on our current path without implementing Safer at Home to flatten the curve, the models show us that we would likely have 22,000 Wisconsinites who are positive for COVID-19 by April 8th and an estimated 440 to 1,500 deaths. This means thousands of Wisconsinites would need hospitalization, and we would exceed our current capacity, our current hospital bed capacity. Yesterday, we heard from the Wisconsin Hospital Association, the Rural Wisconsin Health Cooperative, Leading Age, the Wisconsin Healthcare Association, and others representing frontline healthcare and long-term care providers, urging the public to take all steps available in order to help manage the limited resources they have to take care of patients during this pandemic. Keeping our healthcare system from becoming overwhelmed is our #1 priority. Remember, there are no medications or vaccines to protect us from this contagious virus. The only tool we have is physical separation from each other. I implore you, stay at home. We have to stop this virus from spreading any further. Limiting your contact to less than 5 people total will help do that. Not 5 people at a time, but 5 people total. So that means, as the governor said, no dinner parties, no sleepovers, no kids at the playgrounds, no gatherings. We need you to be in physical contact with as few people as possible. While you are safer at home, the Department of Health Services, along with the governor, the State Emergency Operations Center, and our private sector and healthcare partners are working together to prepare for what is ahead of us. We continue to trace every confirmed case of COVID-19 to find anyone they may have exposed and inform them so they can go into isolation. Isolation not only means staying at home, but staying in a room that is away from other members of your family so that they are not exposed to COVID-19. This critical public health work will allow us to isolate any people who are potentially exposed and will stop them from spreading COVID-19 to others. To help us do this critical work, we have redeployed 60 public health professionals to aid our local public health departments in this effort to do contact tracing. As the governor mentioned yesterday, contact tracing is just one of the 6 strike teams we have been working, that we have stood up to be working on our biggest challenges that we're facing with the COVID-19 pandemic. The other strike forces working at the State Emergency Operations Center are focused on surge planning, on personal protective equipment and other essential medical supplies, our lab capacity, isolation facilities, and finally, as you heard from the governor, childcare for healthcare workers. The Department of Health Services, doctors, nurses, public health officials, and other staff across the agency are working with our healthcare system partners, leaders from Epic Systems and the National Guard to plan and execute this work within the strike teams. There will be more announcements from them in the coming days. While we continue to focus on that work, one thing I'm asking of all of you today is to make some time and think about how you and your friends and family are handling Safer at Home. This is hard. Humans are social beings. We're not wired this way. And this COVID-19 pandemic and the resulting changes in your life and your lifestyles can make anybody anxious and even depressed. Do not hesitate to ask for help if you're feeling overwhelmed. Some resources that we have available: call 800-985-5990. Again, that's 800 985-5990 to speak with a trained crisis counselor or text "Talk with Us" to 66747. Other resources to maintain your mental health and well-being can be found on the DHS COVID-19 webpage. But also you can call and check in on people, see how they're coping, FaceTime with grandma, Skype with your neighbor, Google Hangout with your friends. Stay connected to your support system because we are going to need each other to get through this, but we can do it together. Thank you almost seems inadequate in expressing our gratitude to our partners who are working alongside us to flatten the curve, especially our diligent local health and tribal health officers and our healthcare providers who are on the front lines of this pandemic. The same can be said for private sector partners, business leaders, and business owners who have been so willing to help and have stepped up to ask how they can contribute to the efforts. But our deepest sense of gratitude is for the citizens of Wisconsin. As I said earlier, nothing we have asked of you or will ask of you has been decided without careful thought and deliberation. And true to this state's spirit, you have risen to the challenge each time. We will get through this. It will take some time, but there will be a day when you can go back to work, your kids can go back to school, we can shop, go to the movies, and do all those things that make our lives richer. Like you, I look forward to that day. Until that day comes, thank you again for all that you are doing. We will continue to be transparent and provide timely information as this crisis evolves. Please be safe.